So again, and I hope I don't mispronounce your name, but again, Jan Lepore-Jentleson.
Got it.
Was at least worth an 8 out of 10. Okay.
You got
Again,
it.
she is the executive director of the East End Community Services. Would you believe somebody's calling me right now? Crazy Los Angeles people. Awesome, call them later. Okay. Now a 23-year-old nonprofit organization located in inner East Dayton that services children, families, and adults from all over Montgomery County with a special focus on the Twin Towers neighborhood. Again, before the East End Community Services, Jan was Director of Housing and Neighborhood Development for the City of Dayton for 13 years, where she learned about the poverty suffered by families in Dayton. Jan was employed at the time by NCR in the late 70s and 80s and worked as a product manager in the personal computer division and led a county-wide planning process during the county's celebration of the US Bicentennial. Again, she is happily married for 45 years to the lucky Mr. Don Jentleson, and they have 3 grown children and a beautiful 8-year-old granddaughter.
Right.
Welcome, welcome, Jan.
Thank you, sir. Thank you to Tony for inviting me. Thank you for being here to hear me. And I'll try to make this as painless as possible. Tony is a longstanding board member of East End Community Services. We've been privileged to have his wisdom for a long time, and I appreciate you sharing East End with all of your Civitan members, Tony. So I'm going to I've prepared some material that we can walk through, and let's hope this works. We practiced it, and share, boom, there we are. Okay.
Perfect.
Okay, so East End, wait a minute, okay. So East End Community, I can't find the slide, wait a minute. Yipe, it's going sideways. Why is it doing?
Oh, that's because it goes right to left or left to right. You see the arrows?
Maybe how you're in
See the arrows on your page? On your right side?
No arrows on my page.
Yeah, on the right, all the way to the right, in the middle right, middle. Go down to the middle.
Yeah.
Okay, go.
There. All right, I don't know how I did that, but here's where we are. Okay. So we opened our doors in 1998. We were part of the St. Mary Development Corporation when I was invited to come out of City Hall and try to do some work with the neighborhood where St. Mary Development, which is still in operation, was doing a lot of housing redevelopment work in this neighborhood. And I'll show you where that is in a minute. Some of you may have a vague memory of Xenia Feed and Pet Store, which was well known for many years. That's where our offices are now. My office was where they kept the monkeys, and I have occupied that same space for 23 years. It has no windows, but we own the building. It's all ours, and by golly, it's as raggedy as it can be, but it's all ours. In 2017, well, we stopped being part of St. Mary Development after a couple of years when we got up on our feet, and we maintained independence as a nonprofit organization until July of 2017, when we joined West Care Foundation, which is a national nonprofit that provides human services and behavioral services throughout the country. They're in 19 states. And we were, I think, the 19th actually to join West Care. And they have been able to provide us with some financial stability. They can cover cash flow. I still have to raise all the money locally, but at least they're behind us if we get into trouble. We're serving now anywhere, it's hard to tell right now, but I'm pretty sure it's somewhere between 6,500 and 7,000 people. And those are what we call unduplicated people. So individual people who may get more services um, uh, any time, but if you just count the number of people we touch at least one time a year, it's quite a few folks. We have a budget of about 2.1 million. We've got 56 people, and probably about half of those folks are part-time. So we do a lot for the community without a whole lot of resources. The mission of, and now we're called, by the way, West Care Ohio, but we still do business as East End Community Services because everybody knows us. But our mission is to, and has been for 23 years, to build a prosperous, caring, and healthy community that nurtures disadvantaged children and families towards success. So if you translate that, what it means is to try to break the cycle of generational poverty. And in the last 5 years, the cycle of generational addiction has become a focus for our 2-generation approach. So when I say 2-generation, I mean we're working with kids and families, their parents. So if you think about it, and research certainly validates this, that kids do better when they live in stable families and attend good schools. And families do best when they live in healthy, safe communities that provide opportunities for them to live in affordable, decent housing, have access to healthcare, transportation, living wage jobs, childcare, and all kinds of other amenities. So we're talking about, and I'll get into the details in a minute, but we're talking about inner East Dayton, which is a very poor community. And that's the community that we serve. And it is not the kind of place, unfortunately, that many of us would choose to raise a family, because it's got a lot of, it's an inner city community, and it doesn't have the kind of access to what maybe you and I would view as appropriate and necessary. So our goals, our goals. For children, what we're seeking is social, emotional, and academic development, which leads to high school graduation with plans for some kind of post-secondary training or college. Okay, so we want our kids to grow up healthy, both socially and emotionally. And that's a big issue, because in high poverty communities, there's a lot of trauma associated with poverty. And we want our kids to graduate with plans for their future. They may not all go to college, but there's certainly other opportunities for training, vocational training. And that's what we work with our kids on. For families, we also want social and emotional and financial stability with adequate income that creates positive environments for both the children and all the family members. So, you know, families who are struggling are not always the most stable, and it's not always the best environment for children to grow. So we work with families to try to create those kind of places for our kids to develop. And again, families live in neighborhoods, and our goal is to create safe communities with all of those amenities that you and I would want to raise a family, including civic opportunities for civic engagement and building a sense of community. So I'm going to talk to you now about inner East Dayton. Okay, these slides are just a little off, but all of this are the neighborhoods in inner East Dayton. So Dayton is its neighborhoods are very well defined. The Twin Tower, can you see my cursor here?
Yes.
Okay,
Sure.
so right about here, where my cursor is pointing is where East End Community Services is located on Xenia Avenue. Some of you may know about the St. Mary Church. That's an anchor in our community. So this neighborhood, then over here is South Park. This is Route 35. This whole thing used to be called the East End until State Route 35 punched its way through inner East Dayton and divided this neighborhood up. This is kind of, even though it's a big barrier, there's also some bridges, and we consider these neighborhoods our target neighborhoods. Below Route 35, we are in 45410, and above in historic Inner East, Burkhart and Springfield neighborhoods, these are 4503. These are two of the poorest sets of neighborhoods in the city of Dayton. You can see Oregon District is right here. So, and then we're real close to downtown. I can get downtown in about 4 minutes. So we're very close to downtown. This housing stock is really old. It was built about 120 years ago. It supported factory workers. We just call it worker housing. So it's not very large housing. It's frame construction, and it's been beaten up as all 120-year-old neighborhoods have been. Just to show you some of the demographics. So if you, the color coding is just to show the population. So if you go back here, so the Twin Towers neighborhood is 22, and that's kind of a khaki color. Sorry. So here's Twin Towers neighborhood. We have about 3,000 people. Okay, so altogether, all of those neighborhoods have about 26,500 people in them. And what we're concerned about are the neighborhoods that are how much below the poverty line these neighborhoods are. So you can see, going back to the Twin Towers neighborhood, 53% of the people who live in this neighborhood live below the poverty line, the federal poverty line, which is about $24,000 for a family of 4. That changes every year, but it's about that. The Burkhart neighborhood, which is one of those neighborhoods above Route 35, 57% poverty. So if you pull all this data together, the East Dayton neighborhoods I just showed you has a 41.6% poverty rate. So 41 out of every 100 families lives below the poverty line, and that's compared to the city of Dayton, which is 34.5%. Now, you of course understand that this data fluctuates all over the place. Actually, this is 2018 data. 2019 data, we actually improved a little bit. And we don't know where it is based on the COVID impacts. But from our experience, the last 8 months, that's probably right on the money. So here's a little bit of information about Dayton, our neighborhood compared to the city. So there's about 141,000 people living in the city of Dayton. We're about 19% of the total population. We have a little bit more young people than the city's average, and a fewer percentage of elderly folks. I don't know how significant that is, but we are predominantly white, although we have a relatively high percentage for the city of Latino residents. Black residents have been moving in since I was there when I first started, the neighborhood was almost exclusively 97% white. And it's certainly dropping as the city itself becomes more integrated, and a lot of population movement is from West Dayton into East Dayton because our neighborhoods tend to be more intact than a lot of the West Dayton neighborhoods. One of the things I used to do when I was in the city, one of my areas of responsibility was nuisance abatement. And in the 13 years I was there, I probably took out 8,000 residential structures because they had come to the end of their life. There was just, they were no longer viable, and they were public nuisances, and we had to tear them down. And part of the reason I left City Hall is because after destroying such a high percentage of the city that was never going to come back anyway, it kind of eats away at your soul after a while. And so the goal here in East Dayton is try to prevent the need to take a lot more structures out, and to try to save what we can and keep these neighborhoods viable. Okay. I don't know how to get this bigger, and so if you will bear with me here. Let's see if I can, no. Okay, this is what we call the cycle of generational poverty. And I'd like to start with this box right here. And this is what we're fighting. This is what is going on in the high poverty communities in Dayton and every other city in this country. So starting here, let's start with the birth of a child. That child born in this high poverty neighborhood may have been born into a family that is not capable of providing the cognitive, social, or emotional developmental foundations that now we know our children need in that 0 to 5 age range. Okay, so and we've studied a lot about brain development, cognitive development. I'm kind of a nerd. We really pay attention to everything that comes out of Harvard, and we understand how critical those early years are now. And that doesn't happen in our neighborhoods for a lot of reasons that we're going to get into. So then when the child is ready at age 5 to go to kindergarten, she probably has not had the benefit of early childhood education, because I forgot to mention most of our families are white Appalachian families, and there's a cultural thing about keeping your kids home. So most kids in East Dayton do not go to preschool, unfortunately. And by the time the child gets to kindergarten, she may be up to 2 years behind in her development. So then what happens is, in kindergarten, we've got kids who don't know how to sit in a chair. They're under the desk much of the time. They don't have any skills in terms of following directions, socializing with other kids. They're really pretty far behind, and it makes teaching them very difficult. So they continue, sometimes that gap continues to widen academically, socially, and emotionally. Kids may graduate from high school, but that doesn't mean that they've got 21st century skills that they're going to need to get a living wage job. So they don't have access to living wage jobs, which means that they end up living in low quality rental housing in poor, distressed neighborhoods. The stressors of living in high crime, high poverty neighborhoods can lead to drug addiction, mental illness, lots of depression, and that bodes poorly, certainly for children, but yet their families are created, even though they're living hand to mouth, and I'm grossly generalizing here, so please understand that, but they're still having kids. Okay, they're fragile, but they're still having children, and that cycle just continues. Okay, so these orange boxes are names for what we call the social determinants of health. This is a concept out of the World Health Organization and work done out of Health and Human Services in our country. These are the kind of things that people need to grow up and be healthy. They need a positive social context. Their families need to be stable and provide them with, a healthy social environment. If there are neighborhoods, communities that are heavily racist, and you're in a Black neighborhood or a white neighborhood, and you take a lot of grief for just simply who you are, that's a negative social context. It's not good for families. Education is a critical component. Obviously, having financial stability is a critical component to family wellness. Living in a built environment that is safe and healthy is critical. And then having access to health care is critical, and food. So what we've done is kind of look at the cycle, look at where things all fit in, and we've decided that our intervention strategy at East End is to address these 5 social determinants of health. Okay, basically to put our programs in one of these 5 buckets. So these are the 5 buckets that we have programming in. Remember, I told you we serve 6,500 to 7,000 people a year. They're all in one or more of these buckets. So the first thing we do, because we pay attention to the continuum of education, we are a partner with Ruskin Elementary School, and we have probably one of the most vibrant, robust, effective after-school programs in the state of Ohio. Before the shutdown, we were serving 200 children at Ruskin School, which was about 40% of the whole school. And what the program was doing was helping to close the academic gap. And we do mindfulness with kids, they do yoga, we do self-regulation of behaviors. So a lot of what these kids didn't get when they were younger, we're doing with kids in school so that they're more able to learn. We also have a similar kind of program at a middle school in Dayton. We call it the Pilots Project at the Wright Brothers Middle School. And then we have a youth development program for kids who are in high school. And this is where we try to work with them, get them through high school with a plan. We also do a lot of youth addiction prevention. There's a lot of stuff that I could talk about, but let me just stop for a minute and discuss the addiction issues. East Dayton and the neighborhoods that I showed you is the epicenter of what became the opioid epidemic in our community. And it started back in 2013. Virtually all of the drug overdose deaths were in the neighborhoods I showed you. In 2017, our community, the whole county, lost 566 people to opioid overdoses, and half of those were in East Dayton. Now, when you think about it, these are not just people who live on the street overdosing. These are moms and dads who have children, and these kids are the victims of addiction. We had kids at Ruskin who were coming home from school, finding mom dead in the bathtub with a needle in her arm. We know that kids who experience addiction are 4 times more likely to become drug addicts themselves. So in order to stop that cycle, we've started a thing called Camp Mariposa. And what this is a camp that is dedicated to breaking the cycle and building resiliency among our kids. So one of the things we do, we start out with trying to communicate to children and getting them to believe that it was not their fault that mom was addicted or that dad died. And then eventually we try to bring the families back together again. So that's a big part of what we do. We also do Parent University, which just works with parents to help them learn about academic, social, and emotional development of their kids and how they can support that. Financial stability for families is a big one. We have a job connection center. We do everything we can to help people build their resumes, get job skills, do job searches. We even have a forklift training program. We get a lot of people certified to drive a forklift, which is a great ticket into the many warehousing and manufacturing operations that exist in town. We do a lot to get people jobs. And then one of the things that we do is worry about food. We have a tremendous number of families right now that don't have enough to eat, particularly with COVID. The problem has gotten just out of control. We do, we do a program to get food to people, and we also help people plant backyard gardens. We do a lot of education. We get fresh produce to everybody in the neighborhood when we can, and that's a big deal because malnutrition is not helpful for learning. So we work with a lot of kids on that. So under the bucket category of healthcare, we do a lot of stress management. If you live in poverty, you are stressed out. I can't stress that enough. So we do a lot of that kind of work with our families. Going back to addiction, we work with the Dayton Police Department. We have been since 2016, when the Dayton Police and my staff started going out in East Dayton looking for people who were high, trying to see if we could connect them into treatment, responding to communities, to addresses where there were drug overdoses, and trying to intervene and try to connect people into treatment so they stop using. Now we work with primarily women who have been through treatment, but they're in recovery, and recovery takes a really long time. So we support them. And we just invented something called Miami Valley Meals this summer. We're working with a group of chefs and the Community Action Agency and a bunch of other organizations. We've hired chefs who are preparing meals that can be frozen. And the food is coming from the food bank, and it's food that would go to waste. And so the chefs are able to take this great quantity of food, and we've probably produced and distributed about 60,000 meals since May to the community, to all of Dayton. They're getting ready to do a great big Thanksgiving distribution next week too. So it's a pretty neat partnership that is getting a lot of people fed to supplement what they get from the food bank and what they can buy with their limited incomes. We work with social or seniors. A lot of seniors are living by themselves on a very fixed income, and they need a lot of support. So we provide that. We just brought up a new program because seniors are very isolated, and we're bringing seniors together to learn how they can manage their situations a little bit better during the aging process. And this Creating Lasting Family Connections is a program that helps bring people who've stopped using and they want to bring their family back together. It helps the families heal. We've built under the neighborhoods, we built 84 single family homes with partners, and they're 100% occupied and they're affordable. And at the end of 15 years, and we're coming on that, we're up to 10 years with part of those 84, they will be sold to the people living in them for cheap, and they will be homeowners then. And it's a wonderful program. It's called a low-income housing tax credit program. And these houses were all built in our neighborhood. We own a commercial convenience store. We didn't really want to own a convenience store, but it's vacant now, and it was a neighborhood nuisance, and we bought it to protect the community from other nuisances moving in. And we're thinking and trying to figure out how we can rehab it so that we can make it a neighborhood market, because we're close to becoming a food desert when the Kroger store on Wayne Avenue goes out of business, which we expect in a year now. And then we're working on redeveloping Xenia Avenue. It's a little bit raggedy around the edges, and we have a plan to renovate and do some new development to bring some commercial businesses back into the neighborhood. And it goes with the plan. We also have to do more housing rehabilitation because we haven't been able to do enough of it. And so that we can attract new families to the community. We have a brand new school. We've got all this going on, and it really has become a good place to raise a child. And again, we can help break that cycle. So that's it. That's what we're trying to do. So I can, oh, and then I've got this, yeah, didn't quite work out, but so we've got plans for moving forward, for some big plans. If we survive COVID without falling apart, we have a lot of projects in the hopper that we still want to do. So that's my story. I'm sticking to it, and I'm happy to answer any questions you might have.
Jan doesn't, I've known Jan now for, I think it's 12 years I've been on the board there.
Yeah.
And all of the staff people she hires, they're probably the best at what they need. And when they built those 80 homes, they tore many of the old homes down.
Yeah.
And what they did, they created a business. They demolished by hand houses. You want to just talk about some of the things we did?
Yeah.
Or you did?
So, yeah, there was a thing called social enterprises. And so this was in 2011, 2012, when we were at the height of the recession, and we had a lot of people who needed work. And we landed a federal grant, and we part of the grant was to teach people how to deconstruct homes and then recycle the wood. We started a business, and we trained about 166 people, and all of them were men. And we got a contract with the City of Dayton to do more nuisance abatement. So we tore down, we deconstructed by hand 200 residential structures. And these old buildings were built with old growth lumber. And it was magnificent wood that you could see was hand hewn 120, 130 years ago. We salvaged everything we could. We sold the lumber. We even sent a shipload, a truckload overseas to Japan. We didn't make any money because the shipping costs equaled what they paid us for the lumber, but we put a lot of guys to work, and it was a great success. And some of them had never worked before because a lot of them had just gotten out of prison. So it was quite the effort for deconstructed wood. Now, you know, it's high priced and people are killing themselves to get control of that, you know, that wood. But at the time, there was not a market in Dayton, Ohio, so we had to shut the business down. We learned a lot though, and I think we did a lot of good, and we saved a lot of stuff out of the landfill, so it was pretty cool. So that was that project. We've done so many oddball projects over the years.
And part of that was you certified a lot of people to be able to be certified for asbestos removal and lead removal.
Right.
And these people got jobs after that because of their certification.
That's right.
That
We
never
got
had
them,
jobs before.
yeah, that's right. They all got certified in one or four different professions, I guess you could say, and they were portable certificates. And a lot of guys went out to the fracking fields out in the Dakotas with their certificates and got really well-paying jobs. So,
Thank you. Any other
Wouldn't there
questions?
still be a market for this?
I'm sorry.
I mean, with the city of Dayton, I mean, I would think they still have abatement issues.
Oh, yeah.
I would see this as be something that would be maybe ongoing. I didn't know if you could still like establish that relationship with the
Yeah.
city of Dayton. Because it sounds like a fantastic program that actually not only accomplished the job, but also again benefited the community in a significant way.
Right. The problem was, and will continue to be, that the numbers just didn't work. So we got paid a dollar amount to deconstruct a house, and it was significantly higher than if the city had hired a bulldozer to knock that same house down, because we had to pay more guys because we were doing hand work. And we were depending on the marketing of that wood, the sale of that wood, to supplement our income so we could keep paying the guys, because people will pay a premium now for old growth lumber, but not back then. I mean, we were in a recession, and we're in a recession again. So we continue to look for a business that we can put people to work at, pay them a living wage, and not lose our shirts in the process. And we haven't been able to find that yet.
Okay.
Anything else?
No, other than again, just thank you so much for your time. And again, I think we are all very impressed with all that you have accomplished and continue to accomplish. I actually
They took the lowest scoring school, Ruskin, more than 5 years ago. And then last year on the test charts, they brought him to one of the top three, right? Top three
Yeah.
in the Dayton school system for the highest grade, the test grades.
Right.
And that's through all the programs that they implemented at Ruskin.
Right. That was a few years ago.
They,
Right.